Joining us now is Elizabeth Ziemba. She's the president of Medical Tourism Training. Thank you so much for joining us.
Thank you for the invitation.
Elizabeth, first I'd like to get your reaction to what happened in Matamoros. It doesn't seem very common, but how does an incident like that calculate into how businesses like yours and potential patients move forward and consider a foreign procedure?
Well, certainly the situation in Mexico was terrible, and it is extraordinary in the depth of the violence and the terrible outcome for the Americans traveling for the American group traveling for healthcare. Certainly, any type of risk management and patient safety issues are paramount to the kinds of clients that we work with, whether they're hospitals or clinics or governmental agencies such as ministries of health, that those are the kinds of issues that we talk about. What can your facility, your organization, your government do to maximize the safety of individuals traveling for health and medical treatments? And what measures can be taken to manage or minimize the risk to them, not only for the clinical care they're going to receive, but for the patient journey that they will take to and from their destinations.
Now, many people travel for the lower medical costs, but what are some of the other motivations for patients? Talk to us about the reasons people do travel for medical procedures.
Certainly, price is a very important factor, especially for people coming from the United States who may be uninsured, underinsured, or facing high deductibles. But around the world, many types of procedures are not covered by any type of insurance, whether it's a national health program or private insurance. So many patients will look for healthcare services, certainly for dentistry. It might be for cosmetic surgery, bariatric surgery, fertility treatments, and other kinds of elective treatments, such as orthopedic procedures like hip and knee replacements. It could be to avoid long waiting times. We see in Canada and the United Kingdom that there are very long wait times to receive certain kinds of services. So people look for other options. Or it may simply be services that are not available in the destination where the patient lives. So it could be very complicated medical treatments, involving cancer, cardiac, neurology, or other complex medical care.
And does this take a lot of research? I mean, what are some of the other considerations? You mentioned safety a moment ago, cost, but what are some of the other things people should keep in mind if they are considering traveling, whether it's Mexico, Eastern Europe, Asia, for the specific type of treatment they're looking for?
It's really important for an individual who's considering treatment abroad to take it seriously. First of all, I know that the moniker medical tourism can make it seem rather lighthearted, but really keep in mind that at the core of why the person is traveling is for something related to health or medicine. So that requires doing some research about the hospital or the physician who's going to be providing any of the treatments, about the destination itself, certainly doing things like reading reviews, reading testimonials, having a teleconsultation or more than one teleconsultation with the physician who's going to be delivering the treatment, exploring insurance options. And while an insurance option may not cover the treatment itself, if you're traveling for care, there are other kinds of risks associated, even if you're going on holiday, that you can have a missed flight, a missed connection. Your baggage goes in one direction and you go in another. So there may be ways to minimize the potential financial risks of simply traveling. And I would just say that overall, if the situation being described to you or offered to you, or you're reading about it on a website, if it seems too good to be true, it probably is. So keep doing research, explore other options, and then make the best choice that you can make for yourself and your own well-being.
Elizabeth Ziemba, we appreciate your time. Thank you so much for joining us.